My name's David Newton. I'm the Director of Operations, as well as currently I'm doing quite a bit of the marketing and outreach here at SunCloud Health. I've been in business for the better part of the past 25 years, and I joined Dr. Dennis, who is also my wife, in this new initiative about 6 months ago. Not only because I have personal experience with myself as well as with my family with pretty much everything that we treat here, but also because having come from business and having studied business most recently at Kellogg Northwestern, and then having taken some classes at Harvard Business School with Michael Porter, I've learned that there are just a tremendous amount of inefficiencies that are happening in healthcare in general, and specifically in mental health. And here at SunCloud, we're trying to address those inefficiencies, not just because it's a way to reduce cost for us, for all of our constituents, but also because ultimately we believe that by addressing these inefficiencies, this fragmentation, this disconnect between the physical and the mental, or the physical and the behavioral, we're ultimately going to be improving quality of care for the patients. And really here at SunCloud, particularly under the leadership of Dr. Kim, that's really what we're all about. There's a lot of pressure right now to reduce spend on all areas of healthcare. We all know that healthcare is approximately 20% of GDP and growing. Many argue that it has the potential to bankrupt our country. So from a macro standpoint, it's a really it's a major issue. Thus Obamacare, thus all these changes we've seen, particularly in mental health, for better or for worse. There's a big push right now to get people out of the hospital, which we see in all areas of medicine. And in mental health, it's out of residential or out of inpatient and into outpatient. And from a payer standpoint, at first glance, that seems to be all about reducing cost, because of course in an outpatient setting like here at SunCloud, we don't have 24-hour-a-day nursing. We don't have 40 acres. We're not sitting on the ocean. We don't have equine horse therapy as part of our treatment. We're able to provide care at a significantly lower cost for our patients than they can get at the higher levels of care where they're spending the night on the ocean or in the desert or what have you, which isn't necessarily a bad thing, because there's always going to be that patient population that needs the 24-hour-a-day nursing. But I think what we're focused on here is providing that a longitudinal, sustainable, long-term recovery community where we can, hopefully at an affordable cost, provide our patients with what is, for all intents and purposes, chronic disease management. Because a lot of these things that we're treating here, depression, substance use disorder, eating disorders, trauma, this stuff just doesn't go away. It's not like fixing a knee, and then after 4 months of rehab, you're back onto the basketball court. In many cases, patients have been living with, undiagnosed trauma for decades. And so that's nearly impossible to treat in an inpatient setting over a long term, given the pressure from payers and where they want to see their dollars spent. So our focus here is really in an outpatient setting to treat complex co-occurring disorders on a long-term basis at an affordable cost for patients who need that chronic or that long-term care that we're trying to provide. The biggest key here for us is that we are strong supporters of the shift that's happening in other areas of healthcare It's not yet happening in mental health, but it's slowly taking place from paying for quantity to paying for quality. So there's another way of saying that it's a shift from fee-for-service reimbursement to a more value-based reimbursement, where as a provider, we want to be paid for the value that we're providing our patients or our clients, as opposed to the quantity of services that we're delivering. And as you can only imagine, in all other areas of business where we only get paid if we deliver on the promises or the commitments that we made prior to being, say, awarded the contract. In medicine, that doesn't happen all the time. And for those of us from industry and from business, we find that quite surprising at first glance. Now, once you get into it, of course, there's a lot of nuances, and medicine is very unique. And so there's lots of very good, legitimate reasons why providers have been doing business the way they have for as long as they have. But the shift is happening, and so operationally, we are not only committed to this shift philosophically, but we're trying to implement things like measuring our outcomes here at SunCloud, because there's no way to measure value, where value is a function of outcomes per dollar spent, if you're not tracking outcomes. So one of the things we're doing here, besides tracking cost, is that we're tracking outcomes with our patients. And what we hope to be able to prove over time with enough data is that we can deliver value better than most. Or at the very least, we hope to be in a position, and we will be in a position, where we can provide our patients with information that they need in order to make informed decisions on who to go to and for what. Because we're not going to be good at everything. Nobody's good at everything. But it's hard from a patient's perspective. In fact, it's impossible from a patient's perspective today to be in a state of crisis, which means, first of all, they're not thinking rationally, and then try to make rational decisions based on what they think they or their family member are diagnosed with, on where to go. What's the cost? What is this provider really good at? How do I know they're really good at it? So these are all things that we're committed to being transparent with, working with payers, working with patients, working with their families, working with companies, businesses. We're real strong advocates in the movement of fee-for-service to value. Much easier said than done. It's a long road ahead, but we've already got some partners both on the payer side as well as the corporate side, and we hope to be at the very least a part of that, what we feel is going to be very, very strong movement, again, in the best interest of our patients, which is really what we're all about.